Good morning, I'm Jeff Prater. I'm CEO of Carson Valley Medical Center, and I want to welcome everyone here today and thank you for coming to what is a very momentous occasion for Carson Valley Medical Center. But before we get really into it and started, I want to introduce a few important individuals, really just starting with our board of directors, Dr. Clint Purvance, who is the CEO of Barton Health. We have Cy Johnson, who is Chief of Staff at Renown Health. We have Ann Beck, who is the CFO of Renown Health. There she is. And Dr. Paul Fry, physician with Barton, right there. I don't think anyone really knows Dr. Fry. Also in our presence today is Mr. Ingalls, who is our board chair of our county commissioners. And Mr. Mark Gardner, one of our county commissioners as well. And I do believe I saw Sheriff Dan Coverly walk in. No one knew who you were either. And then also, I'm a doctor, well, unless you went back to school, Chief Carlini. There he is. Welcome. Well, today we break ground on our $40 million expansion and renovation project that has been in the works for many years. And a lot of people were involved in taking part of that to make this day happen. I know just last night I had conversations with the previous CEO who was here before me, Preston Becker, and just kind of talking through some of the challenges and some of the work that goes behind this and how proud he was of seeing this come to fruition. And really giving my thanks to him for all the work that he did prior to getting to this day as well. There's a lot of people who were involved in that. So today's project not only expands our physical space, but it also opens the doors for us to expand and enhance services for the years to come. Now, Carson Valley Medical Center is really rooted in partnerships, and we couldn't do that with a lot of partners in our community and some of those outside of our community. And today we have several speakers who have been part of that throughout this whole several years of getting this moving. But I do have a couple that are going to come up and speak along the way. But one of our partners, Elevation Health Advisory Group, and also Gilbane Construction Company. And so I'm going to ask Dave and Mr. Clays to come up, say a few words. Dave is with Elevation Healthcare Advisory Group, and Mr. Clays is the vice president of Gilbane Company. So come on up, guys.
Oh, wow. Short jokes. We got jokes. Hi, as Jeff said, my name is Dave Powers with Elevation Healthcare Advisory Group. My two business partners in the audience, Vaughn Lambert and Casey Martin, started this about 2019. Jeff and I and Vaughn had done a project back in Alaska, 2010, that lasted 4.5 years. So Carson Valley Medical Center in 2019 had a review done, and this review basically explained what needed to happen for expansion. So Jeff called me, they had a draft plan set up, and he said, how do we do this? And this is how much I have. So I asked Gilbane some advice. We met, we went through the bid process, and fortunately, Gilbane, being local to the area, was able to come in on budget. So I'll let John give you a little information about that. But this is an exciting project. We're very honored to be a part of it, and just want to thank you, Jeff, and the board for all the trust. So thank you very much.
Thank you, Dave. Thank you. Like Dave mentioned, my name is John Clays, Vice President for Gilbane. In conjunction with our design partners, hands up DLR in the back there. Thank you, guys. We're honored to work here. Thank you, Jeff and the board and the hospital staff for having us. We are honored. Gilbane is the 5th largest hospital builder in the country, and with that, you're going to get our expertise and quality. And I want to let you know why this hospital really means a lot to us. Our general superintendent, hands up, Doug, right there. He lives 3 miles down the road, and for the last couple of years, he has been bugging me nonstop saying, you got to get that job, you got to get that job. So I was talking with him, and I said, Doug, you know the hospital, right? He said, John, I volunteered for 16 years for the fire department. I've been in the emergency room 25 times doing CPR next to the dock. So it really is our local hospital, Doug's local hospital. So that's what it really means to us, and we're going to give you that quality. So thank you for having us.
All right, next presenter, Dr. Clint Purvance, our board chair. Now, I think you have about an hour and a half that you wanted to speak about this.
Roughly, yeah.
Awesome. Well, Dr. Purvance has been here since 1999, is that correct?
That's right.
All right, and I know this is an exciting time for him.
Thank you,
Thanks,
sir.
sir. Appreciate it.
Just want to also acknowledge Jeff Prater. He's been an excellent CEO. We're going to talk a little more about him in just a minute, but you know, it really is a historic day today to be here for the Carson Valley residents, for Carson Valley Medical Center. And it's a privilege as a physician that's worked in this community for years and been able to serve on the board and serve the community health needs for years, to actually be here moving a project forward with Doug, who I now recognize from doing CPR in the ER, so that was good. So I see the face now. It's a familiar one for sure. And for years I was here on staff as an ER physician, and then a lot of my journey took me back up to Tahoe. But you know, in reflecting on historic days, I think it's always good for us to think about the history and the past as we look forward to the future. So I just want to take a few minutes to do that because it's very relevant for the residents here. And I would guess that many of you here have been here for generations. Some have been here for 25 years. Chief Carlini and our journeys began together here in the late 90s, and so many of, as Jeff mentioned, the partnerships that have existed have allowed for this medical system and this medical center to grow and expand. Many of those partnerships actually began with physicians that were serving the community before the health system existed. Dr. P.J. Fry and his father, Pops. Papa Fry was an orthopedic surgeon, one of the first in the region here to set up services for the Carson Valley, also having his practices up at South Lake Tahoe. And it was really interesting in looking at the history and being part of that history as well, seeing how not only did Barton Health grow out of a community need back in the 1960s when it built its first hospital, but it also recognized that the Carson Valley, as it began to grow and expand, many of our physicians worked in both locations, and there was a community need for more services down here in the Carson Valley. Back then, the board looked for partnerships, Barton's board looked for partnerships within the Carson Valley community, and in 1993, opened up the Carson Valley Medical Center as an ambulatory center. And at that time, there was an urgent care upstairs, family practice, some primary care and specialty care practices here, as well as some ancillary services, lab and radiology. And in 1995, recognized that more and more services were needed to be local, and in fact, more patients were showing up in critical condition. And so an ER was established, and that was on the first floor, and that began to grow and expand. And as well as additional services like for instance, the surgery division, because we had a lot of surgeons down here, like Pops Fry, who wanted to provide local surgery. In the 1990s, Barton was also expanding. It had kind of worn out its 30-year-old hospital, and it was building a hospital. And at that time, more of the residents of Carson Valley were being transferred up to Barton to have their medical services provided up there. And as Chief Carlini and I talked about this morning, the more services we can provide locally to a community for healthcare, keeping resources local, EMS and other resources local, and of course keeping families and their loved ones local, is the goal of Carson Valley Medical Center. And so we partnered to do that. In 2000, the ED began to recognize that we had patients that we could actually admit and keep in the ED as observation patients. And so we kept patients here overnight for very simple things like breathing treatments for asthma or emphysema, treatments for injuries and or dehydration, or you name it, that was mild, that could go home in a day or two. And what we recognized in that journey is that there was a need for inpatient beds down here at Carson Valley Medical Center. And in 2004, that critical access hospital designation came in play, and beds were established for residents of Carson Valley to stay in the Carson Valley Medical Center. In 2007, we also recognized the critical need for ICU care, and an ICU was open, and that began to expand as well. And then in 2008, a lot of the ambulatory divisions came alongside the health system, and you'll see a lot of growth in the ambulatory division. In fact, part of this project is addressing those ambulatory services also that are not hospital-based. When we began to plan for the future of CVMC, we recognized that it was going to be a very big project, and Barton Health also recognized that partnerships were going to be critical to the success of CVMC. And back in the late 90s, early 2000s, the board of Barton and the CEO of Barton then reached out to other healthcare systems like Carson Tahoe and Renown to see if there was interest in partnerships in the Carson Valley for healthcare. And what formed out of that was a partnership between Renown and Barton, which then created the Carson Valley Medical Center as the not-for-profit entity to support local resources, with a board that included physicians like Pops Fry and then PJ Fry, and members from Barton and Renown as well to oversee kind of the delivery of healthcare services and the expansion of healthcare services in the Carson Valley. We've been wanting to do expansion in the Carson Valley as a team and with many of our community partners for about a decade. In fact, I think that's about when we started talking with our ER radiology surgeons that we need more space, and it's a common theme in healthcare. And we do need space, and we recognize that the building that's behind you is a building that was built to be an outpatient ambulatory facility, not necessarily a hospital. And so we got onto the journey of thinking about what does the future look like and what kind of space and hospital needs do the Carson Valley residents have. Out of that came the genesis of what you'll see and hear about today, which is an expansion of a futuristic hospital and healthcare services to support those needs. We also recognized that we needed stable leadership because we talked about it for many years. We had strong partners to help us in the journey, but we had strong finances due to good financial performance, but most importantly, we had good financial performance because we had excellence in the quality of care and the services that were being provided to the community. And in that, we also needed sound leadership to lead through a project. My understanding is that building a hospital takes a little time and effort, Mr. Prater, just a little bit, right? And it's been a privilege to have Mr. Prater here for the last 3.5 years, committed to this community as well as committed to the health system and committed to seeing this project move forward. It is a big project. It's a big undertaking to meet the community needs, and the community needs continue to grow and to expand. So I'm very excited to be here, be part of that, and to share some of that history with you. I also just want to have us look forward to the future as we look forward to several years of construction, sometimes moving resources around, always trying to best serve the needs of the community as we do that. And as we reflect on the past and we look to the future, we hold tight and true to the principles of what brought us here. And what brought us here as a health system some 25, 30 years ago was the need of the Carson Valley residents and the need of the community. And that's what we're here to serve today. That's what we'll be here to continue to serve into the future. And we're going to continue to partner in excellence in doing that. And then one thing for Gilbane and for Doug, since Doug is a local guy. Doug, I went back, I did a little bit of research just to try to see how much it cost us to build the first hospital here. It was about $10 million, and so I can't figure out why now it's 40, but you know, that was back a while ago. That was in 1993. So, but we understand that there are financial pressures, there are workforce pressures, there are costs of construction pressures that are going to make this a challenging project, but we recognize we have great leadership and great partners. And as a board, we look forward to working with you all as we make this project come forth. So again, I just want to say thank you. It's a privilege to be here to help serve the Carson Valley. It's a wonderful community here, and one we're all very proud of. So thank you. And now it's a pleasure for me to introduce the Chief of Staff from Renown. Cy Johnson is here with us. He's also a board member, a great colleague, and a great collaborator and a supporter of Carson Valley Medical Center in our community. So Cy, welcome.
Thank you, Dr. Purvance. Thank you, Jeff, all the esteemed guests. I'm stunned, first of all, just by how beautiful this day is. Driving down here, it's probably been a little while. I've been on the Carson Valley Medical Center board for probably about 5 years. And before COVID, I used to come down here many times a year and we'd talk and do the work that some of us have been referencing so far. And I think in all those drives, I was involved in something or another and distracted. What an amazing place this is. What a beautiful place to live and a beautiful place to be. So I'm very excited to be here, very excited for what this project holds for this community in the future. When I think about the future and what we're seeking to accomplish with this investment, it's all about the community. The mission of Carson Valley Medical Center, the mission of Barton, and the mission of Renown all come together, focused on what can we do to help serve the health and healthcare needs of this community. That's what it's all about. And so all the time that we've spent in the past decade, I wasn't here for all of that, but for about half of it, I can attest to how much time has been spent focusing on understanding what are the needs of this community, what are the healthcare needs, what are the diseases, what's the growth patterns, what do we need to do to be very focused on what's coming for the future and make sure that we're positioned to meet those needs very effectively and support the community in the fundamental way that is our mission to do. And so that's what we're focused on. Partnerships has been referenced by everyone up here, and I think that's because it's so fundamental to both this project and to our collective ability to really deliver on that promise of supporting the health and healthcare needs of this community. And so our plan as this project comes to pass is to continue to collaborate and work very closely together, certainly Barton, Renown, Carson Valley Medical Center, all of the other participants in the medical community here and around Northern Nevada to make sure that as we move forward and as this investment comes to pass, I hope it looks and feels as beautiful as this day when it's all done and open. And as that all happens, it will be because we've all stood together, worked together, and focused on why we're here and what this is all about. And we will bring more services, continue to increase the service capacity, the capabilities, the reach as the community grows. It's going to be a very bright future. So I want to thank you all for being here. Thank you for letting us be a part of it. And thank you for your commitment to this facility.
Well, that was one of the things that we did order up besides the seats and everything was the beautiful weather. So very welcome for that. Now I'd like to introduce one of our commissioners, Mr. Mark Gardner. Come on up, and he's got a, I think, 35-minute speech, something like that. No. No. I think your boss spoke. Thank you. Thank you, sir.
Thank you, Jeff. I appreciate the opportunity. I'm honored today to have the opportunity to speak on behalf of the Board of Commissioners in regards to the expansion of Carson Valley Medical Center. I can tell you, as I look at this agenda today, I think my reputation does precede me because Dr. Clint was given 5 minutes and Cy Johnson was given 5 minutes, and yet I'm on the schedule for 10 minutes. But so anyways, but I'll try to keep my comments brief. I can tell you it was on behalf of the chair, Mr. Ingalls, that's here today with me also. We met with Jeff back, I believe it was February, was it, John? We met with Jeff, and he unveiled what we looked at as the future expansion of this hospital and how great of an opportunity and what it was going to bring to our community. But and we were very excited about that. But Jeff swore us to secrecy during that meeting. We couldn't talk about it at all. And I can tell you, John and I left the meeting, and we were chomping at the bit to boast about the expansion and what this new facility was going to bring to our community. We were very excited about that. I think Dr. Clint did read some of my notes because he talked about the founding in 1993, which is in my notes. What he didn't tell you, though, is that at that time, Douglas County had about 30,000 residents only. Okay, so at that time, maybe that facility, in this facility behind us, behind you, was capable of taking care of our community. But our community today now, as the census is coming out, is just about 500 citizens short of 50,000. So without any further expansion of this facility, we've been able to handle from 30,000 to 50,000. So that's a significant increase in our community. And this new expansion is so critical and so important to our community. We appreciate the partnership we have with Barton and with Renown in bringing this $40 million expansion to our community. The other demographic that I'd like to share with you is we have an aging community. Our community is right now at about 30% demographics of 55 and older. So once again, healthcare is extremely important, and we expect that number to grow as families age in this community. We also have approved a senior citizen a mobile home, manufactured home complex just to the just to the east of this facility for 55 and older. So the access of our senior citizens to this community and to this hospital is very, very important. I'm also extremely happy with the partnership that we, and a lot of people don't know this in our community, is that Carson Valley Medical Center makes annual contributions to the health and upkeep of our senior and community center, and also contributes on an annual basis to our DART program to the tune of about $25,000. So once again, it's not just this hospital, it's all the resources that this hospital and its partners bring to our community in being a real partnership. So the thing that we're really proud of, especially my wife and I this month, is that, and that's my wife here wearing pink today, as I'm wearing pink, and you'll see me a lot with pink in the month of October, because October is Breast Cancer Awareness Month, and so we're very happy with the partnership that we formed with Kimberly Bodenstein of your Carson Valley Medical Center Foundation, and your awareness and emphasis on mammograms this month, in the month of October for Breast Cancer Awareness Month, and what we're doing here in our community in that regard. With that, I don't know if John, have you been timing me? I don't know if you had the timing lights on or anything, but it's time to cut it off. Thank you. So anyways, I will do that. But once again, thank you so much, Jeff, for the opportunity on behalf of the Board of Commissioners to speak today, and the importance of this expansion. So thank you.
Thank you, Commissioner. I think you can all see from the comments that have been presented so far this morning is really the importance of this project to our community. And we thank all of those who are here today who helped us get there, to get to this part of the finish line, if you will. But I think it's important, as I look across the crowd here a little bit, and everyone else that's in the hospital right now working, is really to thank our staff. I think it was mentioned about a decade this has been going on and been talked about. And I know that when I got here 3.5 years-ish ago, the first thing staff talked to me about, we need more room. Hey, Jeff, come down to our emergency room and take a look. You know, all those things. And you know, these guys have really persevered during this whole time. If you could just see the amazing things that these guys have done with the space that they have currently, it's just amazing to me. They provide care at the service level of the large hospitals and doing it in a small space. It's just phenomenal. And then I see Patrick back here, who's got to figure out where to put all the supplies in that space. And I know he's still worried about where to put the supplies in the new hospital as well. He's made that known to me very much so. But you guys have persevered. You guys are the reason this hospital continues to move forward, providing great care to our patients and to our community, being part of our community. So I want to thank all of you guys from the bottom of my heart, to thank you for the job well done that you do. So thank you. I also want to thank the board of directors for Carson Valley Medical Center. There's been a couple of meetings about this project that we had to go through, just a few. And part of getting our certificate of need completed, putting up with the constant questions that I have of of what are we going to do, how are we going to do this, how are we going to pay for this, and they said, Jeff, how are you going to pay for it? And so, but really their guidance and leadership for me has been outstanding. Never have a doubt to be able to pick up the telephone and ask questions of my board and help lead this organization forward. So I just want to thank you guys very much as well. And I also know that my review's coming up soon, so I wanted to say thank you for that. So thanks. The providers in our facility, you too have worked in these spaces for a while, and I know Dr. Overos is like, hurry up, Jeff, get this thing built. We have patients waiting in the waiting room. We're out of beds in the emergency room. Well, now we're going from those 5 beds to 12. That's awesome. And with that, 2 observation beds to go into the emergency room. For our surgeons as well, going from, I call it 1.5 OR rooms. They sometimes call it 1, but 1.5 OR rooms to 3 OR rooms with 2 dedicated procedural rooms to do all of our endoscopies so that we can turn over cases more. Right now in this building next to you, we call it our C building. It's been called different things over the years, but right now it's called our C building. And inside that building right now is already, it's part of the renovation that's going on. We're taking our physical therapy department from 200 square feet, it's 2,000 square feet to 8,000 square feet. I know sometimes it feels like 200 square feet in there. But just going to be an amazing thing in there for expansion of those services. I know our orthopedic surgeons, and where's Renee? I know Renee he's out here making sure that I'm really going to say it, and that's really happening for him. Also inside this building, right now, they're already putting sheetrock up on our sterile processing department to support our OR and to support the needs of the operating room, and be able to expand those so that those operating rooms and procedural rooms are operating at full capacity, something the CFO is excited about. But also what we're doing is we're going to expand from 23 beds that we have now that are combined with 2 beds in some of our rooms to private beds, 25 beds. We're adding 2 beds to our license. And so we'll have 25 private rooms, maintaining our 4 ICU beds that we have today. We're also going to be expanding some services within our imaging department, actually adding interventional and cardiac cath lab to that space. A new service line for us that's I think is going to be, I've told my wife, and there's my beautiful wife sitting right in the middle, Miss Kamala, and I tell her several times, I don't like the word game changer. I just never have really liked that word, but to me, that's going to be a game changer for this organization. And really to be able to provide those cardiac services here locally that we have to sometimes send out. And our number one reason, Chief knows this, is that for our transfers outside of our emergency room has been because of cardiology. And it's been that way for years, and we're starting to address that. So very excited about what we're doing. I know one of the things that's important to a lot of folks is, what's this going to be bringing to the community as well? Well, we know during the course of this project, there'll be added about 100 to 150 jobs to the community. And then over the course of this build, and as we start to provide more services, we're seeing about a 20% opportunity of increasing the number of staff that provide services here at Carson Valley Medical Center. So I'm gonna talk real quick about just briefly the schedule, so you'll know what's coming next. And I'm gonna say this out here because it's gonna be on video, Mr. Clays. So that way we make sure that we hit these dates. Is that okay? All right. So right now, as I mentioned, the rehab center next door, and an expected completion date of January 19th of 2022. The sterile processing department to support our operating rooms, February 24th of 2022. So just right around the corner, start to see some of those things that are already in the works be completed and come to fruition. Where you're seated today in this green space, in November, November 19th starts some of the exterior work. And then on May 4th is really where you're going to start seeing a lot of the construction begin, where you start to see the bulldozers and the traffic congestion and things like that around the campus, where we start to really move dirt and and start building this place. Is that right, Doug? All right. I'm just making sure they're saying yes to all these dates. Got you on record. All right. And then what I'm excited to invite all of you back for is our grand opening in the first quarter of 2024. So we begin to start seeing patients in our new facility, in your new facility. So in closing, breaking ground today on this hospital expansion project is the first step toward reimagining healthcare in Carson Valley. For all of you, for all your families, and for generations to come. So thank you very much. So now it's really the moment we've all been waiting for, is really to officially break the ground. And so I'm going to ask our board of directors to come up and join me up front. We're gonna have some hard hats and shovels, and we're gonna move some dirt.